An absolute refusal to accept that any life is worth less than another. Make sure that their stories are being represented, that their voices are being amplified, and that there is a seat at the table for those women. So it's exciting to see that technology being harnessed to streamline and enable those frontline workers who are driving social change at the ground level.
I'm Phoebe Stone, and this is Connect to Capital. To keep up to date with the rest of the Connect to Capital series, please visit our website via the link below, or head to our Spotify and YouTube channels. Today, I'm delighted to be joined by Enla.
Hi, Phoebe.
Really wonderful to have you here.
Thank you so much. It is an absolute pleasure and a joy.
You've had a very interesting career in both academic terms and also from a corporate perspective, with a clear focus on the generation of positive impact. Can you start by talking about some of the work that you've been involved in with Mothers2Mothers and Qure.ai and what this does to further health advancements?
Absolutely, I would love to, and it's a topic that I'm extremely passionate about. I think actually what underpins the work of both Mothers2Mothers and now Qure, a company which I'm extremely delighted and excited to have joined only around 4 months ago at the beginning of the year, is something which a real idol of mine, Paul Farmer, who is a clinician and an anthropologist, has termed as an absolute refusal to accept that any life is worth less than another. So for Mothers2Mothers, that commitment takes the form of a 20-year journey to tackle HIV through a model which is seemingly very, very simple, but in many ways extremely complex, involving training and crucially employing women who are themselves living with HIV to provide frontline healthcare support, mentorship and psychosocial care to other women in their communities around them. It's, as I say, something which is seemingly extremely simple.
Effectively a peer network.
Exactly.
Yeah.
But it's very, very effective. It's that shared experience, as you say, from one peer to another. You're able to actually cut through some of the misinformation, the fear and the stigma on the basis of shared experience to translate that new trust into phenomenal health outcomes which couldn't have otherwise been achieved. So for Mothers2Mothers, that means in very tangible and measurable terms, which I know that we'll speak about a little bit later, 9 years of virtual elimination of the transmission of HIV from mother to child, something which sits far below the UN benchmark for where we expect it to be at this point, and also impact at scale, which is translated across a number of different countries and environments on the basis that it is absolutely about empowering people to create change within their own communities in the context that they uniquely understand and have the expertise to navigate.
And there's something incredible about a human passing that information to a human and that being a real world interaction.
Absolutely. And what's really interesting for me now is that I've moved into the tech sector and into the world of artificial intelligence, which in some ways seems as though it's a shift away from that human connection. But in fact, it's really an organisation, Qure, is an organisation which is committed to utilising the latest advances in technology to free up those frontline health workers, those social change makers on the ground, on the front line, to do the human work that they are only and uniquely qualified to do. So it's exciting to see that technology being harnessed to streamline and enable those frontline workers who are driving social change at the ground level. So something that I always find to be an enormous privilege is to be able to learn from and find enormous inspiration in the stories of the women who are driving the change for Mothers2Mothers, and then to translate that for different audiences and make sure that their stories are being represented, that their voices are being amplified, and that there is a seat at the table for those women to share the change that the companies support is able to make in their individual lives.
Enla, Mothers2Mothers is an NGO and Qure is a corporate. Can you talk about the transition of moving from an NGO to a business?
Yeah, absolutely. And I will begin by saying that it's not a transition that I had anticipated making. But having met Prashant Warrior, who is the founder and CEO of Qure, actually in Helsinki of all places, back at the end of 2022, I was really struck by a really fascinating combination, which I think we're beginning to see more and more within the private sector, excitingly, which is a fundamental commitment in the DNA of the organisation to driving social change, while also combined with all of the capacity that comes with the private sector to pivot, to innovate, to take risks, to shift in response to a rapidly changing environment. So for me, actually, what I'm seeing within Qure is that actually a lot of behaviours and ingredients that you might have traditionally associated with the charity sector, as I say, a resolute focus on the needs of the patient, actually, at the end of the day, and to driving social change, working in an area which has often been overlooked. And also making sure that the latest in technological innovations are actually being placed in the hands of those who need them most.
And your role is focused on identifying and bringing in philanthropic partners and donors in order to fund some of these incredibly impactful projects. Can you talk about the importance of those partnerships and what they mean to you personally?
So I think what's been really exciting for me across the course of my career, both in the philanthropy sector, the traditional philanthropy sector, and now in global health through the lens of a company, is that there seems to be I think that the distinctions between different sectors are becoming more porous. I think that the private sector and individual philanthropists are beginning to acknowledge more and more the incredible value that the third sector and NGOs bring to the table in terms of community knowledge, lived experience, and also trust and access to networks of individuals who have systemically and traditionally, historically been left outside of the system. I think obviously we all know the enormous financial resource that the private sector can bring to driving social impact. But I think, again, what we're beginning to see is a more collaborative approach to driving shared value between companies and NGOs in the pursuit of driving more sustainable change, which is invested in achieving the goals of business and society in the same space. We saw that in so many different ways at Mothers2Mothers through partnerships with coming immediately to mind companies like British Airways, and Roche Pharmaceuticals, who helped us and supported us financially to expand into new markets, new disease areas, taking us into, for example, West Africa for the first time in Ghana, but also lending expertise, knowledge, market understanding to help us navigate those new areas smoothly. Bringing different resource to the table, the bright minds of the companies themselves, while also having that kind of expertise be absolutely respected on a par with the lived experience and expertise of the frontline health workers who understand uniquely how to navigate the complexities of driving social change at a human community level.
It's a really good demonstration, I think, of the collaboration and parties that need to be involved when we are looking to achieve systems change.
I absolutely agree. And I think fundamentally what you're looking for there, and this is the kind of bastion for any NGO, is actually to demonstrate impact to the extent that you can hand over to government ownership.
Which Mothers2Mothers has done.
Successfully done in multiple countries, beginning in Kenya, exactly. And it's so it's that kind of cycle, that ecosystem approach, as I say. It's the companies who are enabling and supporting innovations. They're supporting the development and the growth of NGOs into new areas that then can be proven and, as I say, handed over.
And one of the elements in which you can prove that model has worked is through it being taken on by government, but there's also an element of the impact measurement and reporting as proof, and that can be proof of success of the philanthropic deployment of capital. And we've spoken before about the challenges behind impact measurements. Can you just start by sharing some of your views? And I think we'll probably take the conversation from there.
Yeah, absolutely. I think this is something that I'm constantly thinking about. And actually starting my new role with Qure has been really challenging to kind of a set of ideas that I might have held quite firmly. I think it goes without saying that we live in the world that we live in, and I think it would be extremely sort of naive to think that we could be measuring impact in any way that didn't involve quantifiable numerical return on investment. I think that within the development sector, and specifically within global health, there has been for a very long time, and still to today, rightfully so, a real neoliberal focus on good governance and on numerical measurement of impact, particularly in terms of scale. So when we're again talking about the intersection between the private sector supporting and driving social initiatives through NGOs, there's often we often find that there is a very real focus on reach. So reach figures is the kind of gold standard in terms of
lives touched, for example.
Exactly. The number of people who have been impacted by a particular project or a particular intervention, which is fantastic and very important. And at Mothers2Mothers, and at Qure, from between 16 and 20 million lives have been impacted by the work of those two organisations. I think what I would really challenge, I suppose, investors, social impact investors and philanthropists to increasingly think about is really engaging with what impact means for those communities that we're trying to support and uplift. I think impact does not happen in a political vacuum. And I think, or in a social vacuum, and I think quite often with Mothers2Mothers as a prime example, that there could certainly, Mothers2Mothers could increase the numbers of people that they would be reaching by compromising the standard of care that they're providing. And it's critical when you're dealing with such a fraught political, social challenge like HIV, that you're looking beyond the impact figures. It's not just about reaching someone once, testing them for HIV and moving on, but it's very much about that sustained support to ensure that that person is held and supported throughout their journey. I think, yes, what I'm now seeing at Qure, though, on the other hand, is the very real value in being able to produce rich data quickly. What this potentially means for disease surveillance, hotspot mapping, if we think about this obviously in the context of COVID-19, but also in the context of the impacts, for example, of the climate crisis on health. Using cutting edge technology, which is producing data, which obviously is very, very carefully protected, particularly when you're thinking about patient data, but nonetheless rich, deep longitudinal data that can also be used to potentially, as I say, fortify against some of the more unknown risks that are potentially on the horizon for global health.
No, I think it's an incredibly important point, and there's actually one of the impact bond funds that we hold in some client portfolios. They send a survey out to the people that receive the benefit of the impact bonds, and whether that's social housing or training opportunities and what that's done for their life. So it's not, we've tried to provide all this training, therefore their life is better. It's hearing from the individuals themselves, then amalgamating that information, which is a crucial voice that's so often left out, to your very eloquent point.
Yeah, I think, yes. And I know also LGT is a big supporter of Mothers2Mothers, and I know that they're very sophisticated in terms of philanthropic thinking. I guess like one of the big trends in the philanthropic sector has been a move towards unrestricted funding. So that's funding which isn't designated towards a specific project and a specific numerical outcome within a time-bound period, but rather is a kind of trust-based investment in the organisation to deliver social impact in the way that they deem to be best on the basis of the experience that organisation has accrued. And we've seen obviously Mackenzie Scott, some of the big bang funders in the US working very much in that way and shifting towards, as I said earlier, kind of increased trust in the NGO sector to be delivering impact in the way which best represents the needs of the clients, the patients, the individuals and communities who they seek to support and serve.
It's almost like we've come full circle, because I felt like that was probably the philanthropic model a few decades ago. Then people have created these parameters, restrictions, clear outcomes to try and hone and define and maximize impact. And then there's sort of a realization that perhaps impact with philanthropic capital can be maximized through that less restrictive approach.
Absolutely. And I think this also tallies with, this also tallies with a move towards supporting more localized organizations. So I think it's hopefully, and I'm always an optimist, but hopefully this represents a kind of shift away from maybe a more paternalistic model of international development and support towards really entrusting and enabling those people who are really driving change on the front line.
Yeah. And this has been an amazing conversation. And like you say, we could have gone on for many more hours, I know. The last question that we ask everyone that comes on this video series is, in the spirit of connection, whether you could recommend someone to join me here as part of the next series of the video to further this conversation.
Yeah, absolutely. A very good friend of mine and his co-founder have recently developed a company called Qure.ai, which is really building out to become the platform for the neurodivergent community. Obviously in the context of sort of an increasing awareness of the challenges of neurodiversity, but actually obviously not the funding necessarily or the access to resources to support that upsurge in awareness. Both Zareed Ali, who is the one of the founders, and then Felix de Grey come from extremely different backgrounds and bring their understanding and expertise from a range of sort of different environments, from city planning through to education to bear, as well as their own lived experience of the challenge at hand.
Well, you're very, very kind, and I'd absolutely love introductions. And this has really been a fascinating conversation. Thank you so much for joining us.
You're so welcome, and it's been a pleasure. Thank you so much, Phoebe.
To keep up to date with the rest of the Connected Capital series, please visit our website via the link below, or head to our Spotify and YouTube channels.